Hi dear students, tuning in from SolRx and from the pharmacy. As promised, I wanted to do a brief video about this drug, Ubrelvy, also known as ubrogepant, which is kind of hard to pronounce, but it is a new novel medication for migraine management. So this medication, its mechanism of action is it is a CGRP, calcitonin gene related peptide receptor antagonist. So it's a CGRP receptor antagonist. The calcitonin gene related peptide pathway has been shown to contribute to migraines. So antagonizing and blocking this pathway helps and has been shown to improve migraines. So how is it different from your traditional triptans like sumatriptan, rizatriptan? Your triptans are vasoconstrictors. So we have to use those medications in caution in patients with a cardiac history, like in those with a history of a heart attack. Whereas these medications, the ubrogepant, Ubrelvy, this specific one bypasses that vasoconstriction because it doesn't work that way. It's a CGRP receptor antagonist. So studies support its use in cardiac patients. Although in the available evidence, severe cardiac patients were excluded, but there is emerging evidence saying, well, we don't want to use triptans in cardiac patients because of vasoconstriction, so we can use Ubrelvy. How do we take it? So the dosing, first and foremost, is 50 milligrams is the starting, and it goes up to 100 milligrams. Similar to triptans, you take it at the onset of the migraine. Once you take it, you have to wait the 2 hours in order to repeat the dose. Okay, you have to wait the 2 hours. If there is no benefit, you don't take a second dose. If there is a partial benefit, you can take a second dose at the 2-hour mark, and the maximum daily dose is 200 milligrams. Ubrelvy is also a 3A4 substrate, so we have to be cautious in those who are taking cytochrome P450 3A4 inhibitors. And I think that's the main thing that I can think of. So it's newer. We don't know its exact role, but it's an alternative to triptans in those with a cardiac history, and maybe in those that do not tolerate triptans, and see where it goes. So there you go. Oh, one more thing. The studies say that patients should not use these medications for more than 8 times a month, because the studies, when they did the studies, they looked at it at a max of 8 times, not 8 days, but 8 times a month. I'm not saying they can't take it for more than 8 times a month, but that's typically what the recommendation is. So they say 8 migraine attacks a month. And there you have it. We'll see you soon. And there's your Ubrelvy.